Minister Varane, Health Minister from France, Ambassador Seydoux, distinguished panelists, ladies and gentlemen. It's a pleasure to join today's celebration of UHC Day, the International Year of Health and Care Workers, and the Gender Equal Health and Care Workforce Initiative. It's a year ago, almost, that the initiative was announced by the government of France on UHC Day 2020, aligned with their work on the Generation Equality Forum and the partnership with UN Women as co-hosted by the governments of France and Mexico in preparation for the Paris meetings that were happening earlier this year. The initiative aimed to increase the advocacy, the visibility, and the actions on the agenda of women in the health and care workforce, which is so notable this last 2 years with the COVID-19 pandemic, in addition to what we knew before. And it was through a partnership of a government, France, a non-governmental organization, Women in Global Health, and a UN agency, WHO. So a slightly different trilateral engagement to drive this work forward. Critically, this is not the first time that France has been promoting this agenda. It was tabled by France, South Africa, ILO, OECD, and WHO with a particular agenda and recommendation on women and gender and women's rights in the UN's High-Level Commission on Health, Employment and Economic Growth back in 2016. That recommendation resulted in a whole series of resolutions and the adoption of the Working for Health Action Plan, with women in the workforce one of its core central tenets. So this gender equal health and care workforce initiative has added to that existing engagement and really strengthened the momentum. And as we'll hear from some of the speakers in today's session, we'll hear of excellent progress throughout the year. Thank you all to those who have supported this work, from the partner organizations and all the external parties that have engaged with us. In May of this year at the World Health Assembly, member states requested the Director General to develop in particular through a member state-led process, a new action plan on the health and care workforce. This comes in the recognition of the role of health and care workers at the forefront of the COVID-19 pandemic, at the forefront of our ambitions for universal health coverage. That action plan, led by member states, will be tabled at the World Health Assembly in May next year. We see this as a critical opportunity to bring the evidence, the actions, and to address the gender gaps in the health and care workforce throughout all the health systems, to get this as a central pillar of the next 8 years' actions at the global level, the regional level, and importantly, at the national level. It will enable us to integrate the evidence, the ideas, the proof of what works where into an action plan, and enable WHO's normative work, the leadership functions, to be really driven down to the national level. It will enable us to assess, to review, and provide guidance on the gender transformative actions required to ensure that women have a decent and safe working environment, that they are protected with statutory instruments, that they are given career development and leadership opportunities, and they are free from all forms of harassment and discrimination. As we have learned from our sister UN agencies, institutionalizing gender equality work into national action plans is a strong predictor of sustained progress over time. Importantly, by doing so and by integrating this into the action plan, we will also be able to establish and utilize the policies and reporting mechanisms to assess progress over time, including reporting to WHO governing bodies. The momentum this year, I'm convinced, demonstrates that an evidence-informed agenda can be harnessed and that progress is possible. Let me express my sincere appreciation and thanks to the government of France, to Ambassador Seydoux and her team, to Minister Varenne and his team, to Women in Global Health, to their chapters all around the world for the positive collaboration this year to really drive this agenda forward. Let me thank also the many partners who are making their own organizational, institutional, personal commitments to the Women in the Workforce agenda. I wish you all a safe and healthy holiday period, and especially should you be visiting friends and family, to take all necessary precautions against COVID-19. We wish you very well and look forward to working with you in 2022.